Hello and welcome to the newest edition of Pro Pharma Talks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And what we're going to be talking about today is some home remedies that need some myth busting. You know what I mean? Like some of these remedies you've heard from your mom, from your nana, from what do you call your grandma?
Your bubby?
Bubby, your bubby. I mean, you don't have to go and tell them we're myth busting. This is just science. We're just laying out the facts. You can choose to believe them or not, but, well, it's not belief, right? It's been tested. It's been tried and true.
Well, I think the important thing when Alex and him brought this to me was there's a lot of remedies out there that are well known, and now because of the internet, you're hearing about things that you didn't hear from your mother or your grandmother, things like that. My mother was famous with chicken soup, warm tea with lemon and honey for colds and all of that. So, we all grew up with something. But when we dealt with these kind of remedies, the important issue is that one, a lot of them do have some science behind them. Others of them are more of a placebo, so they compare to, some medicines or things that can be done. Right. And then also, there's some issues where they've been brought up and they're just wrong. And so we'll talk about some of those areas.
And then there's a whole other category where they just brought it up and somehow, some way, scientifically it worked out. Well, let's just get right into it. One remedy that we've heard of was Krazy Glue that being used for small wounds, like small little cuts.
Yeah. This actually is one that has science behind it.
Okay.
Krazy Glue has been studied to treat small cuts, whether they're paper cuts or small cuts. And the idea is that the Krazy Glue contains a fundamental issue that is like a issue to cover cuts, etc. It's very effective in small cuts. It's very effective for stopping bleeding in small cuts, associated with less scarring than other options.
Oh, wow.
Some surgical issues have done where they've studied it in order to deal with putting on an elastic gel over the area so it helps with skin healing. The important thing is that there is a component to it. It's cyanoacrylate, and the cyanoacrylate effectively is there to put this bond over the skin. It dissolves within a few days. If it becomes a problem, then you can put water and a little bit of soap on it, or you can deal with nail polish remover in order to remove it. But in general, it'll wash off in a couple of days. And it is being used in surgery in order to set up these elastic gels. What you have to be careful about is that it can irritate the skin, it can kill skin cells, and it can aggravate infections. Absolutely do not take it orally because it is a poison. But it is important to know in all of the things we're going to talk about, anything, one of the things you're worried about is infections. And so if there is an infection there already, then that's not a good idea. If there isn't, you just got a paper cut or a small cut, not infected, putting it on actually is a very effective means of dealing with the problem.
It's one thing I would have never thought of is I got a cut, I immediately need some Krazy Glue.
I mean, when we were growing up, it probably wasn't anything that people thought about, but there have been studies with it, and it's like a Band-Aid in putting it on, or in some cases, butterflies that put the skin together and cause a layer in order to grow. So Krazy Glue has some benefits and some science behind it.
That's good to know. So mark that one down on your list. It's a good myth. So moving on to the next one. This one's like a category. So there's several different ones within it. Treatment of burns. So a lot of people have used different remedies. We're gonna go over a couple. One is to put butter on a burn.
Yeah, putting butter on a burn is really a bad idea.
Sounds like a bad idea.
Putting butter on a burn, or even an ointment on a burn, what that does is to cover the skin so that the heat cannot get off the skin. Meaning, what you want is when you have a burn, it becomes inflamed, it becomes hot, and that's because all of the internal materials come in order to fight it. Well, in order for the healing to occur, that heat has to be removed. What happens when you put butter or an ointment, something on the skin,
Right.
is that you stop the heat from being removed. So as a result of that, the heat and the other elements that come to fight the burn, they stay, they cause more inflammation, they cause more problems. So as a result of that, what you really want is not butter or ointment, you want cool water, cool running water on the area, and then to use something like aloe vera or otherwise, where you've got something that will fight infection. And at the same time will give a cooling nature, because you don't want it to be hot.
That seems interesting. Why was this ever an option? Like, let me grab the nearest thing closest to me and just like put butter right on a burn. I mean, it doesn't make sense.
I've heard of it. I think my mother came up with it once until I told her no.
Okay. With all due respect.
Until I told her no, we're not going to do that. But
Right.
you know, these things happen, and people get the idea that somehow it's going to be a benefit. In most of the cases that we're talking about here today, there isn't a lot of science behind it, and so you're dealing with things that may have benefit, but they may have placebo benefit, where it may make you feel better. What we need to do is to make sure we don't do the wrong thing.
Right. Like put butter on a burn.
Right.
How about toothpaste? People use toothpaste.
Yeah, toothpaste has calcium and peppermints. They increase the risk of infections on the skin. So if you have a burn, you don't put toothpaste on it, because what you're trying to do is ensure the fact that you don't get an infection.
Right.
Burns have at least 4 different levels based on how deep the burn gets into your skin. If it's blistered, that's a real problem. But in mild kind of skin burns, toothpaste is an idea here. You don't want to hurt the skin tissue, which toothpaste can, with the calcium. And second is you don't want toothpaste on it, because you can be elaborating an infection from it. And by the way, whether it's Krazy Glue, whether it's toothpaste or others, make sure that it's clean, that it hasn't been sitting a long time, that it's not all dusty or dirty, because that can add an infection to what you're trying to do, even if it's the right thing to do.
Right. Okay. What about honey? Using honey on a burn.
Actually, that's kind of interesting. There is evidence that honey can soothe burns. It is antibacterial and it is anti-inflammatory,
Wow.
which is one of the reasons why you take it orally in tea in order to help you with with a cough or sore throat,
Right.
because it's anti-inflammatory. So it's effectively making the inflammation get smaller, get more treated. So there is some evidence that honey on a burn does have some
Healing
evidence
properties, yeah.
and healing properties, but it's not the only thing.
Right.
And to be honest, you don't take it and lather it on, because you're not helping anything. Once again, lathering and putting too much of it on, you once again hold the heat in, and so you don't want that. The idea here is, if you're going to use it, is to use a very little bit in order to get the antibacterial and anti-inflammatory effect, not to have a big lather of it all over.
Plus, you want to save some honey for your tea, so you don't want to drown the burn.
That's correct.
How about aloe vera?
Aloe vera, this has science behind it.
That's the one I use. I use that one for sunburns.
Okay.
Especially when I'm at the beach.
Aloe vera does have science. It has been studied. It is for first and second degree burns. So first degree burns is just in the upper level of the skin. Secondary burn gets below the dermis in what goes on. So it's first and second degree. It is anti-inflammatory, so it helps to cut down on the inflammation from the burn and the sloughing of the skin. It does promote circulation. So in the burn, you're effectively killing skin, so there isn't circulation. In
Okay.
this regard, it's bringing circulation back into the area. So in that regard, it helps, and it does inhibit growth of bacteria. So aloe vera has multiple properties that makes it very useful for burns.
It's interesting. How about for like cuts and scrapes? You know how when you're playing like football, you know, like me, yeah. You play football and then you fall and you got a big old scratch on your leg, right? From whatever was on the ground. Maybe there was a rock or something.
Right.
So, and my mother used to always do this. She'd apply hydrogen peroxide and then have you sit there, at least have me sit there and wonder why I did that, and also let hydrogen peroxide kind of air itself out. How about that as a remedy?
Well, that's a problem.
Uh-oh.
The reason for using hydrogen peroxide or even rubbing alcohol on cuts and scrapes is the idea that it's antibacterial.
Right.
The problem with it is that that antibacterial activity is not the solution for this because it's harming the tissue and it's delaying healing. What you really need to do for those areas is to have cool running water on it with a mild soap. You want to remove all the debris. You want to remove all of the dirt or whatever that you've collected on it so that you have it clean. And then you can use aloe vera or some antibacterial cream, usually a double antibiotic, not triple, because neomycin in triple antibiotics is topically sensitizing. It makes the skin more red than what it started with. So in that regard, you use something that's a polymyxin bacitracin, known as double antibiotic kind of area, and use that for cooling the skin. What you want to do is to make sure that the scrapes and everything that are eliciting an internal response for inflammation, you don't want that to stay hot. So the cool running water helps to pull it away. It hydrates it. It removes any chances of bacterial infection, and then you try and cover it up. But dealing with hydrogen peroxide or rubbing alcohol is a bad idea.
Thanks, Mom. That explains some of the scarring I got. But okay, let's move on before I get more depressed. When you get a nosebleed and you just have that reaction where you just throw your head back and you gotta stop the bleeding somehow, right? Because you don't want the blood to keep running and gushing through your nose. So what about that myth about if you just tilt your head back, you can stop the bleeding?
Yeah, actually, that's the wrong way to deal with it.
Wow.
If you tilt your head back with bleeding, then what's going to happen is that the blood is going to roll down into your throat, and you're going to potentially swallow it and cause stomach ache as well as vomiting. What you want to do is not throw your head back, but slightly tilt your head forward. Em's looking at me like this is not happy. But the bottom line here is the following, is that what you want to do in order to deal with nosebleed is two things. One is pinch your nostrils together to make sure that you're causing an area for clotting because you're trying to create a clot. Number two is that you're tilting your head forward so that you're not bringing the blood backwards so that you're swallowing it. That way, any bleeding or additional bleeding is going to go forward and not into your throat. And it also helps to reduce the blood pressure in the veins so that you're promoting the veins to help with occasioning more clotting opportunity. This way you're not improving clotting opportunity. This way you are. Now you don't put your head in between your legs, but you're
Just
putting
tilt
it
slightly
down,
forward.
tilting it a bit forward in order to do that.
So you don't get blood on your clothes and stuff.
Yeah, you don't want blood on your clothes. It's important you don't blow your nose at the same time. If you do, then you can be blowing off a clot. What you want is you want a clot to form. Anything that's going to put pressure on the area is going to create a problem. So as I've indicated, by tilting a little bit forward, you reduce the blood pressure of the veins in your nose. But if you blow your nose or you deal with something where you go backwards, then you're increasing the blood pressure, and you don't want that to what goes on.
Interesting.
Yeah.
Yeah, I was told that one to never put your head back, and I was like, you're crazy.
I was told that one too.
Yeah.
But I was also told that if you put something cold on your forehead and you sniff rubbing alcohol, it'll stop the bleed.
That is insane. The theories that you come up with, that's Em, our producer, just in case you're listening.
Oh, well, let's address that for a minute. Number one is cooling is always a good thing, because if the person has a headache or bleeds sometimes, it's because they're dehydrated. And so one of the things you want to do is try and hydrate the area. Clearly, taking water orally is a great idea. But at the same time, if you can cool the area, then what you want to do is to try and cut down on the heat that's removing heat from your body. I mean, when you sweat and when you get hot, you are removing heat from your body. What you want to do is to cool it, so you cut that down. And then putting alcohol on is an interesting idea, but once again, you're interfering with skin turnover. You're dealing with problems with regard to smell and things that makes it worse. And while you expect it to be a counter irritant, which is kind of like what you do with Vicks Vapor Rub or stuff like that, alcohol doesn't act as a counter irritant. So in that regard, it's not a great idea in what we're talking about.
Yeah, when you put the hydrogen peroxide on a cut and it starts fizzling up, that's a bad sign.
That's bad.
I thought it was a good sign. Gosh, Mom, we got some talking to do. All right, so this one is actually my favorite. This next one, when you put Vicks not for the foot fungus part. I don't have that problem. That's not me. But for headaches or for any kind of aches in your chest, that kind of thing, you put Vicks Vapor Rub on it, and then you lay back and relax and let Grandma sing you a little lullaby. How about that? Well, not the lullaby part. How about Vicks? Vicks for foot fungus, headaches, aches.
Yeah, Vicks Vapor Rub, eucalyptus oil are kind of staples that people have done for probably a few thousand years in what they've done in spas. Eucalyptus oil in order to open up the chest, open up the area, because they increase circulation. So what you're doing is in areas like where you have chest tightness, you are using potentially Vicks either in a humidifier, you're putting it on your nose or your throat in order to try and improve circulation and open things up to do that. So that's very common, and it's correct. People tend to look at that as being an old wives' tale, but in fact it's real, and it's the same reason why people go to the spa or they go to areas in order to sit with eucalyptus oil in order to try and open up, improve the circulation for what goes on. But let's take one at a time. The first one has to deal with nail fungus. It actually turns out that that Vicks does have some benefit here, and there is some science behind it. Em is very excited about this. But it has a benefit that probably isn't a lot different from a placebo, and so let me address what's going on. Nail fungus, typically something is a fungal infection called onychomycosis, and what it does is to invade the nail beds because it burrows into the nails and then also burrows in to the skin below the nails. It really likes warm, damp areas, and clearly under the nails is warm and damp, and the nails, etc., from being out in the air can be dry, but if you wash your hands or you're swimming or something like that, then all of this gets wet. Bottom line here is that the nail infections can occur either because of fungal infection, which is what it is. Certainly aging tends to increase the thickness of nails so that they don't heal as better. and psoriasis. Athlete's foot that is untreated can deal with toenail fungal infections, and potentially also injuries. And nail polish, if placed on wrong, there have been issues where women get nail infections because of the way that their nail polish and all of that is not being treated. The management issue is that using Vicks for that is not a cure. It's management. Cure for a fungal infection means that you have to treat the fungal infection, and Vicks doesn't have antifungal properties. What it does have is that it's probably similar to what goes on with topical antifungal drugs that you put on. The problem with them is that there's no blood vessels in the nail, so as a result of that, you don't get good circulation in the nail. You may get it in the bed underneath the nail, but when you're using the topical skin type things, they're not really getting into the nail bed under the nail. So as a result of that, if you treat for months at a time, there may be some benefit. There has been some benefit to some of these, of about a 35% improvement, but within a couple of months these things return, and so you haven't really cured anything.
So is it more of a calming effect kind of thing?
No, it's not calming. It's really an issue where you're getting an application that has to go on for 10 months or more, for which you're going to get some benefit, but it's a management problem. If you really have a nail infection, what you have to do is you have to take oral drugs in order to do it, and there's complications in that can have some liver function problems, but in general, most people can take them, but it takes several months in order to deal with it, and then removes the fungal problem entirely.
That's interesting.
So that becomes an issue. Now,
so all your joy kind of got brought down a little bit.
Now the issue with headaches, there is some benefit in taking a very small amount, applying it on the temples, and what it does is to relieve pressure because it's improving some circulation. And so as a result of that, there is some benefit, the same as you would with a humidifier or vaporizer, by putting Vicks Vapor Rub or eucalyptus oil. Now, in fairness, my mom used to use this on us as kids. It smells horrible, but at the same time, it does open things up, and it's really something that you want to use, not with a minor cold, but if you really have a horrible cold, that it has a issue to open things up.
I disagree. I think Vicks Vapor Rub has kind of grown on me
Okay. Now there's a couple of other areas. One is M came up with one where you take a little bit of Vicks, put it on a cotton ball, stick it in your ear, leave it for several hours, and do this several times a day. That in general is a waste of time.
What are you trying to do there?
But it's important to note that it's not just Vicks. It's like you have to do it with the rue plant.
I see. Okay.
So you put a little Vicks and you put it in there, and it's supposed to help when you have an earache.
Yeah. If you have an earache, there are many scenarios, but let me deal with the two most common. One is you can have an earache that is non-infection, meaning it's just an earache. In that particular case, it's self-limited, it's going to go away, but it's painful. So what you do is you give them Tylenol, and you commonly give this to kids as
Take Tylenol, get over it.
As Tylenol. The dose for kids is 10 milligrams per kilogram of the child, and in this regard, their pain normally goes away in 1 to 2 days and is taken care of. You can put this cotton ball in, but in general it means nothing for you. Improving circulation in the ear when you have an earache is not necessarily what you want because it's increasing pressure in your ear. That's not a good plan. Now, finally, is the issue that was brought up as for stomach aches, and menthol and eucalyptus do soothe smooth muscle by improving circulation. Really? So there is some benefit increasing circulation and dealing with it for stomach aches, but I would immediately suggest that over the counter you can get a what's known as an H2 antagonist like Pepsid
Right.
or
Bismol.
some of the others. And what you want to think about is if you have a stomach ache, is one to try something like Tums. You can use every hour. If that isn't working, then you can use an H2 antagonist in order to deal with it. And then if it's really severe, then hopefully a physician has dealt with it, or you can also get over the counter when you can get with omeprazole or otherwise. So having said all of that, there are treatments for these problems. Our issue here is that yes, there can be some benefit, but our problem is that they may be more of a placebo benefit, and the question is,
Right.
is someone going to do it? Putting Vicks and dealing with it for the stomach, you frequently dose frequently. Many of these have to deal with how much you've put on, and that becomes an issue.
So it's not that it doesn't work. It just doesn't really have healing properties. It's a management thing, like you said.
Yes.
It's just a way to maintain it.
Yes.
Okay.
Yeah.
So here's one that I haven't heard of: witch hazel. Witch hazel for headaches.
Witch hazel has been used in the past for headaches.
Like
Some
a
people
long time ago, right? Like a really long time. Have you heard of witch hazel, Em?
Witch hazel isn't a thing for
It's
us.
not a thing,
Yeah.
right? Right.
Yeah, it's an older one. It was used for migraines as well as headaches.
You can tell who came up with this one. I'm just putting that out.
I brought it up there. The witch hazel contains tannins, oils that lessen inflammation. The idea is that you take a little, you put it on your forehead in order to try and decrease inflammation, try to get any kind of circulation and effectively to help it. What really was done is to take a cool cloth, wet it and have a cool cloth, put a little bit of witch hazel on your forehead and do it. The idea of the cool cloth, once again, was to cut down on inflammation of your blood vessels that are pumping out and are improved during a headache. This way you want to cool it off, allow, cut down on the amount of water loss, local hydration,
Right.
and then, of course, to deal with the witch hazel in order to try and deal with it. This is more of a placebo effect. It may be of benefit, it may not be. People used to use it and may still use it because they're concerned that they don't want to continue to use NSAIDs or ibuprofen, naproxen, drugs like that. So they're trying to stay away from some of these drugs, especially if they have high blood pressure and things like that.
Or just
So
having a
there is,
stigma attached to people not wanting to take drugs.
Yeah, they're really,
Yeah.
in the case of witch hazel, there's no science behind it. There's no real benefit of it. But the real issue is that when you have something that's a placebo effect, you don't want to overuse it because all you're doing is then adding dose that creates more problems, and that you don't need.
Right. Now here's one that's more of a Hispanic culture type. It's a hot tequila and honey for a sore throat.
Yeah.
And it works. I don't care what you say.
Tequila is agave, right?
Right.
It reduces bacteria and relieves sore throat. So there is a benefit here. Mixing it in warm tea or even warm water does have a benefit, and especially with honey, which is not only soothing but also a cough suppressant. So if you mix them together, there is some benefit. You're getting the anti-inflammatory effects, and you're getting decreasing, the sinus mucus, and of course with the tea, you're adding hydration. So there is some general benefit. There's no science behind it. I had a Russian professor years ago who had a cure for the common cold, but which took a lot of vodka, but it also took him 3 days to recover from his cure. At the end of the day, these kind of things have no science behind them, but they certainly are of interest in what people have tried.
Well, he cured the cold, and then he had to get over the hangover.
Yeah, that's right. Yeah.
Yeah. So and then there's what is it? Purple onion tea for cough.
Yeah.
That one I haven't tried.
You haven't tried that one. The issue here is onions. Onions cure colds, cough, fevers, sore throat, etc. This is purely, there's no science behind it. It's just purely identifying that there is some impact of what this is. So we're not talking about a scientific method. We're talking about the fact that you put onion in particular teas. There were some people years ago, in my father's time, who would take a piece of garlic and hang it on a string if someone had a cough or they had some viral infection, etc. And that was supposed to ward off. More often than not, it warded off people. So that if people had the problem, they weren't coming next to you because you had this thing of garlic around your neck.
Maybe he just believed in vampires.
I don't think my father even believed in it, but it certainly happened with what goes on. The issue for all of this is that there is some benefit. There's no science behind it, but at the end of the day, you're dealing with a very small amount and trying to get the benefit. In this case, this is a dose-response relationship. If you gave more onion, you may get a benefit, but you'd get all the side effects of the onion that you don't want.
Mm-hmm.
So in that regard, without the science, you're playing with something that may have some benefit, may have some sort of a placebo type effect. But if you have a cough and the cough is just every once in a while, then it will go away, especially if it's non-infective. If it's infected, you have to treat the infection.
Right.
But if it is consistent and is going on all the time, then you need to have a cough suppressant, and in that regard, you need something medicinal like guaifenesin that is available in products like Robitussin and other products, because you do have to deal with a cough, mostly because you don't want to create any stomach problems from the constant pressure of your diaphragm with the cough, and you don't want to add to issues. If it continues, there is always the chance of an infection, maybe not antibacterial, and in that case, then you have to address it and deal with those problems.
So you're not saying don't try it?
I am not saying don't try it. I'm saying that if you want benefits for it, you probably have to take more and more of it, and more of it is not helping you because the onion in a higher dose is not going to be what you started with. It may help with these problems, but then it makes it worse as you increase the dose.
Okay, now this one's for the ladies. This might help me at home because my wife tells me all the time chamomile tea or oregano tea. So how about oregano tea for menstrual cramps? Does that work?
Yeah, it's possible, but there is no science behind it. In this particular regard, the oregano tea probably is not better than chamomile tea that is used. So where people have talked about it, what you really want to use is chamomile or peppermint tea because they have an anti-inflammatory effect. The oregano it treats gastrointestinal disorders and potentially soft tissue like muscle cramps, but it's not as good as chamomile or peppermint. So while you want to try it, once again, no science behind it, certainly potentially a problem, but you can do a lot better by just changing the nature of the tea and going after something that does have some benefit. Either way, there's no science behind this. It's just try and see if it works.
Okay, now this one is it's a little weird. I've never heard of this one. Tomatoes used for tonsil aches.
Yeah.
That's a strange one.
I haven't heard of this one either. Tomatoes, especially in tomato juice, is a real problem here. Tomato juice is acidic. You don't give acid to someone who has a toothache, a tonsil ache, any kind of ache, because all the acid is going to do is to make it worse. So if the idea is you're going to use tomatoes, someone may think that that's a good idea, but that's really a bad idea. So of the many ideas we've talked about, some of which have some science, some of which have potentially some benefit. This one is a really bad idea.
I should clarify. You're not actually eating the tomato. So what you're doing is it's supposed to help reduce swelling.
Uh-huh.
So you actually put the tomatoes on underneath your, your chin, like here, and you bandage it or something to hold it in place, and it's supposed to help reduce swelling.
You're gonna put it underneath your on your throat.
Well,
Yeah,
let me make
place it on
one quick
Okay.
comment before Em kills me about this, which I'm sure she will. Tomatoes,
If you
whether
see
they're
me,
in
swear.
tomato juice or they're just a native tomato, this is an acidic product. You in general do not put acid on the skin, and the reason is it tends to break down the dermal tissue. You break down the dermal tissue, what you get is an opportunity for bacterial infection. All of the things that we talked about for burns and everything else, what you're trying to do is to make sure that you're not improving the chance of a bacterial infection.
Right.
You want to reduce the chance of a bacterial infection. So
Right.
while tomatoes may be an interesting, potentially very optical kind of approach,
Yeah. Visually, it's fun.
visually, yeah. But putting them on the skin as an acidic is not a good idea. Most of the lotions and creams that you put on, you want to have as neutral, not acidic, not basic, but relatively neutral. That's why you go with some neutral soaps, like ivory soap and things like that, Neutrogena soap that are not acidic or basic, so that you're not breaking down the skin.
And,
Tomatoes on it is an interesting idea, but is really a bad medical idea.
Interesting, really interesting, like questionable, or interesting, like interesting.
Well, my oldest son says that if I say it's interesting, it means I don't agree, but I'm trying to be polite.
Well done. So if you gained anything from this conversation, it's that infection is bad, right?
Yes,
So you want to
yes.
reduce the chance of infection at every cost you get, and don't
Yes.
put tomatoes on your skin.
Yes.
Please don't put tomatoes on your skin. So just a quick recap. Krazy Glue is actually good for small cuts, but
It
just
is.
make sure you don't have an infection there already.
Right.
Putting butter on your burns is not a good idea. Don't do it. Don't try it. Save your country crock for your toast. Toothpaste is not a good idea. Save it for your teeth. Honey is actually a good idea.
Yeah.
But just a little bit.
Just a
tad.
little bit.
Yeah. Aloe Vera is great for burns because I
Okay.
use it.
It is.
Especially for the sunburn, and it's for my Mexico trip too. Also, cuts and scrapes. Do not put hydrogen peroxide on your cuts and scrapes, Mom. Throwing your head back for a nosebleed is not a good idea. Tilt forward a little bit. Pinch your nose. Vicks is a good idea, from what I gather. Vicks is actually a good idea, but it's only to maintain. It doesn't have any healing properties.
Correct.
Right?
Correct.
Right? So, Nana, Mom, Bubby, all of that, we're good on that. So, and witch hazel for headaches, according to this guy, it's good. It works. It has some good properties.
No science behind it.
And purple onion, try it at your own risk. And oregano tea is not a good idea. Stick to chamomile or peppermint.
Yeah, you forgot your favorite, the hot tea, tequila and
that
honey.
goes without saying. You don't even need to mix that tequila with water. You can just take it. And you got anything to add, Em?
Yeah, I forgot to write down that the tequila and honey, you're supposed to add a little lemon too.
Oh, okay.
Yeah.
This is like my mother's cure, the chicken soup with hot tea with lemon and honey, cure for the common cold.
And for everything else.
And
so.
for everything else. That and my Russian professor with his vodka cure that takes you 2 or 3 days to recover from.
So if you're Russian, it's vodka. If you're Hispanic, it's tequila. So, I mean, there you go.
And if you're Jewish, it's a chicken soup with hot tea, lemon, and honey.
Yeah, but that's not as fun.
Yeah.
Yes.
Anything else you'd like to add to this?
No, but we tried to deal with some of the common things. We're taking it in a pleasurable way. No one's trying to be offensive. But there is evidence behind some of it, not a lot of evidence behind the rest of it, but you should at least be aware of the consequences
Right.
before you're going to do that. And tell them what we're going to do next time.
Next time we're gonna look at some other myths that in regards to healthcare. Of course, we're in a healthcare realm here, so we got to stick to our expert. So we'll go over some other myths next week, and if you have any and you would like it discussed here, and we could either debunk it or certify it, please leave us a message, DM us. We're available on Facebook, on Twitter, on Instagram. Em always keeps us up to date on all the social media stuff. And also, I'd like to remind you to go to propharmaconsultants.com. We have a free information page called RxInfoX. And also, like our podcast. Also leave a review if you're at it too. Anything else? Yeah.
No, I think that's it.
Good?
Thanks for joining us.
Yes, and we will be back next week with your myth episode.